Hey, Charles, we're live, Charles. We are live, I think. Let's see here. Yep, we are live.
Yes.
Charles. Oh, here we go. All right, all right. How you doing, my man?
Doing fine. Doing fine.
Another long day at the office, bro.
Well, went to Lihui today. Did some things happen today, but we can discuss that later because it pertains to COVID procedures. So I think might be interesting for everybody to know. Yeah, but other than that, no. Aloha, gang. It's a beautiful Monday. It is the ninth. Today is the ninth, and so glad to be with all of you. Yesterday, Sunday, was a nice day off. And like anything else, we try to bring as much as we can to all of you. And sometimes when we don't have the guests, there's things that happen. They kind of come on for some reason or another. We understand because we have to work around their schedule, and it's okay. But we got a lot of material, and I think a lot of interesting things. But today I was in my jokester mood, so I had posted a lot of jokes.
I saw, I saw.
I figured,
Um, it's good though. It's good, break
yeah.
the stuff up because today was one of those days that created a lot of confusion for a lot of people. A lot of confusion.
Yeah.
And I think that creates more tension. You know, I still don't understand how we cannot get it straight after 8 months. I don't know how you cannot come up with a reporting system that's accurate, number one, that's consistent, number two, and that is that every island is on the same page. I don't understand how we haven't figured that out by now. Because if we haven't figured it out by now, then there is a very good chance that we will never figure it out. I don't understand, like, everything is, I guess, monitored by the Department of Health. So
Mm-hmm.
you have a department. By the way, we're gonna on Thursday night, we have our mayor Derek Kawakami and Dr. Berriman will be on to talk about testing and to talk about what Kauai is doing to curb this virus. So that'll be Thursday. Wednesday we have Dr. Kapono Chong Hansen and Dr. Aquino from Maui. And tonight we have Charlie and his Snickers bar. Uh-oh. There goes Patsy. There you go. Where's she going? You must have candy in the ice box. Cannot be because I went to read that earlier. And oh, I know what you. I know what you can get. So so yeah, Dr. Kapono Chong Hansen uh, will be on with Dr. Aquino from Maui, and that one's gonna be it's gonna be powerful. It's gonna be good. So anyway, as Charlie shows you his Snicker bars, carrots. My
Ooh.
wife gave me carrots. And it's actually not that bad. I love carrot. And when you get tired of carrot, you get
Celery.
celery. And hmm,
Well,
anyway,
let me just say, when you get done eating one of these, okay, you throw the wrapper away, and hopefully, and then all of a sudden up here comes another one.
hmm.
So,
Sherry said that is why she gotta pull her teeth. Mel has carrot teeth. Look, Raylene said, "I'm gonna get my ice cream. Stop it."
well, what's kind of I just tonight is, I don't want to be too scientific, but in a way you have to. What doesn't make sense, and it's just one of those things. But having been in the field of reporting deaths, like I have, medical examiner's office. A lot of things for and I can only speak for the city of Honolulu, city and county of Honolulu, which is a metropolitan area, and the the system is a little different from the outer islands, but the reporting is all done the same because it all goes into the Department of Health, goes into registrar. Once it's confirmed, it's validated, the death itself. So if you're gonna do a report on a Thursday, all reported deaths have to be actually logged in by Wednesday at a certain time. And then it rolls over the numbers to Thursday. I would think that would be the easiest thing to do, right? And not try to load up the numbers of cases up until the last minute. You make it the day before. So if there's tests that was run and the results came up by Wednesday and it can be reported on Wednesday, then what happens is the numbers that came out of that batch would actually be reported on Thursday. So you don't have to go back and forth wonder, hey, confirm you sure this number is correct or not. But these guys, and when I use the term loosely, but when these guys start reporting, you have to find out where's it coming from. And I saw a lot of frustration today, a lot of comments. They were talking about it earlier in Facebook. Just a lot of frustrations because you get one report that says this number and then it flips to this other number, and like we were just talking about going on the air, we had 110 cases that was confirmed by the lieutenant governor on one news organization, and then after that by noontime you have a case of a lower number. So basically there was a difference of 46 cases or 45 cases, right?
26, that is.
That's a lot. That is a lot. It's nothing to sneeze at. So when you get on black eye with that many cases, and it's an oddity at that point, you really got to ask yourself, gee whiz.
You know, I think a lot of people rely on the information that they get. So when the KITV posted, I mean, many people are like us that you put your notifications on for KITV, KHON. So
Mhm.
whenever they come out with a new story, you get notified on Facebook. Goes to your cell phone or your smartphone. So when you get that report, and we're coming off two back-to-back 128 case days, and then you get the KITV report that was confirmed by the lieutenant governor at 110. That sounds about right. We know Mondays day is a low reporting day because the lab isn't working fully staffed on Sundays on the weekends. And then you read the Star Advertiser. They do an online report as well, and it says, "Ooh." Now remember, the KITV report says 110, and then the state comes out with their report, and then the county has their report. The Kauai report, I think it was 71 with no new cases for Kauai. The Star Advertiser said we had 2 new cases on Kauai, and then you get the HAIMA, the Department of Health report, saying that we only had 64. What? Listen, hey Kauai, Department of Health on Kauai, how many of you guys got? Okay, Maui, Big Island, that goes into the big state report, and the state report pushes the send button, it goes to all the media.
It's too simple.
That just makes too much sense.
Yeah,
Um,
anything
and,
that's
and
too simple and too much common sense, it's not challenging enough for the brainiacs, right? That's what everybody says. You and I come up with all these very simple guides because we've been following so closely, right?
yeah,
And everybody said, you guys are right. And I said, well, maybe because it's too practical that you remember before it says, hey, if it's too good to be true, it's probably not true. These are one of the times where you don't want to listen to that. You want to just say, hey, we went through the numbers. This is what the numbers show. But still, you don't like accept it.
uh, And for the life of me, I cannot figure out why. Why not? We're talking about four counties, four counties. That's all. We're not talking about 100 reporting places. No, four, all run by the Department of Health. So how can you have, and then the lieutenant governor, who is the guy in charge of this pandemic supposedly, how can you not get it? How can each news agency have it differently? I did find out. I know there was a lot of people asking about the two on Kauai. You'll see the correction tomorrow. That two that the Star Advertiser, how in the hell they figured that out or found that out, I don't know. But there were two cases, two Kauai residents that contracted the virus on the mainland. So they should not be counted for Kauai. They should be counted because they contracted the virus up on the mainland. But they posted it for the Kauai number. So now that freaks everybody out on Kauai that saw that. I didn't see it. Well, one of our viewers actually messaged me or posted on our post about the two that the Star Advertiser wrote about. Again, that should not happen. You see, to the state, you guys are tasked with getting us through this pandemic with the least amount of tension and stress and worry. Really, that's your job. And you know what? It does it. You wouldn't have to pay me $100,000 a year to figure that out. Just the reporting, Charlie, you hit it right on the head. Set the midnight hour. Okay, everything. Does this? How's this concept? Right. Today is October. I
Right.
mean, November 9th. November 8th is from 12:01 to 12 o'clock. Right. 24 hours. So why don't we report all the cases on November 8th so that we all the four counties going to report on November 9th the same numbers. Is that difficult? Is that
Mhm.
difficult? Now, you see, that would cover us to midnight the day before. People would know that the numbers we're getting today is from yesterday, and all the four counties would have the same number. All the media would have the same number, whether it's KITV, KHON, KHNL, whatever, Star Advertiser, everybody would get the same number. Let's just say we collect all the data from midnight the day before, the night before,
Mhm.
and by 10 a.m. we shoot out one press release to all the media outlets with the report for the day before. That never cost the state one penny. That just came from Mel Raposo, free. But you know what? Everybody would be on the same page. Everybody would understand the numbers, um, and they wouldn't be. People are on edge right now. People are on edge. Kauai get one case, two cases. It freaks people out. And in fact, for today, that wasn't even accurate. So why not come up with a reporting system that is just consistent for everyone and managed by one agency, which should be the Department of Health, and the Department of Health should be responsible. Now, don't get me wrong. I appreciate the transparency of our county administration. You see, because they tell us the cases, they'll put a press release out when they find out that a positive case was reported. I'm not saying to stop doing that. I appreciate that, but I know that cases that the mayor is releasing to the press, I mean to the media, yeah, to the press, is not in yesterday's report. This is going to be into the day after. We were going to understand that. See, right now at 10 o'clock in the morning, 9 o'clock in the morning, you get different numbers. Different jurisdiction get different numbers, statewide numbers. So that's where I think the stress is unnecessary, and a lot of that can be alleviated simply by improving the reporting system. I don't know how you cannot get that done. I don't. I really don't know how you cannot get the correct number out after 8 months now. After 8 months,
Well, some of us we like to have certain vices. Some like to exercise, some like to drink, some like to play pool, some like to golf. I will say this though: when there needs to be some type of confirmation, right? You bring out a playbook, and everybody has to buy off on the same playbook. I don't care what it is. It seems pretty apparent that the state and everyone involved with COVID does not play off of the same playbook. And we said from day one, when messaging gets really bad, and you're trying to get the people to buy off to to calm everything down, to bring a sense of calm, right? You cannot accomplish that when you have all these erroneous type of information happening. Okay, so we can go back and look at the missile alert. Remember the missile alert, which caused
Yep.
some of us to jump into removing manhole covers to protect children and whatnot. Okay, that is a prime example when everyone during a training is not on the same playbook. The real alert will go out. Okay, and why the governor is not on the same playbook? You ask, because he didn't have the password to shut the system down. It had to take someone else. It had to take someone else. So we're going to be inundated with these kind of problems, and I can only foresee it's going to happen more often than none, because we're supposed to have numbers ramping up, right?
Yep.
If you look in the continental United States, they were just talking about Utah. Utah is going into a mandated mask usage. You have to wear a mask. All these states that was so relaxed, they didn't believe in mask use and all of this stuff. Now they got no choice. They got no choice. I don't know if any of you heard about Pfizer and the vaccine, 90%, but now it looks like 90% it's working, but it's only short term. And two of the test subjects, they got I think one or two of the subjects that got the actual vaccine, the two test protocol to build up the resistance, actually caught COVID after being injected with this. So there are a lot of things that's happening right now. And you know what's really funny? Remember what Dr. Kim said? He said that when a vaccine is to come out, you cannot rush at this. You need to go through a comprehensive trial study on this vaccine, and that involves thousands and thousands of test subjects, right?
Hmm.
So you've got the actual vaccine, and you got the placebo, which is bulai, right? Placebo
Hmm.
means okay,
Sugar pill.
yep. So how does one? They don't know who takes what, but man, would be embarrassing, right? If you the guy to get the sugar pill and you say, "Oh boy, the bugger work," right?
Yeah.
Because and you know and you sitting in Washington at the CDC or wherever saying, "Hey Joe, I hate to tell you, but you had the bulai one, so I don't know what you was feeling."
Yeah.
So you know,
Yeah, it's very promising though. I mean, we're way ahead of the game. I know, the vaccine is some people will never take that vaccine. I was watching the news today. A couple of the news, the medical experts that were on the news channels, the various news channels, very
hmm
excited about today. 90%. They thought it was going to be about 60% effective when they were doing the trials, and so at 90%, they're very excited. And we should be hopefully beginning of next year, get some of those vaccines out into the general public and start the process of getting rid of this virus. So we'll see.
you know how I
See how it.
know how that bugger gonna be really effective if they were to tell me, Charlie, we're gonna lace all the Snickers with vaccine. That's how I know the bugger gonna work. If you to tell me right now, it's gonna be on Snickers. I said, man, give me the family bag. I'm all in. I'm all in.
Yeah, I want to address a comment about someone heard there were 5 cases on Kauai today. I can say that's not true. I'm not sure where this is coming out. Um, and if you know, if you can shoot me in a private message your source, because I'd like to investigate it. But I did clarify with the and if you watch the mayor's report today, he made it very clear we have had no new cases over the weekend and today. The only 2 cases was that 2 cases that was actually on the mainland on Kauai residents. So I'm not sure where, but the 5 cases, 5 positives, 2 residents and 3 visitors. I'd like to know your source, really, because if the Department of Health is hiding that, then I'd like to investigate. But honestly, in my experience with the Department of Health here on Kauai, Dr. Berman and the mayor's staff, chief of staff, Sarah, I don't think, I mean, I have grown to, really rely on their information and trust them. So, yeah, if you have any information on positive cases, private message me the source. I will definitely investigate because that's alarming because I, I don't want that information to be spread out if it's not true.
Mhm.
5 cases is a lot of cases for Kauai in one day. We know we did have 5. Um, the last run, we had 2 and 3, but today, no, zero cases today, and in fact, 0 cases over the weekend. So, just want to make that clarification there. Charlie, did you see Mayor Caldwell's press conference today?
A little. I saw the first 3 words, then I turned the channel. I'm sorry. I sorry, but I heard it didn't. It wasn't. You know what? You know what upsets me the most when you have a pandemic going on and you're trying to shoot to open up, right? If you believe, and I believe, but if you believe you can open up safely, open up safely. Let's just open up safely, like a restaurant, right? Again, we talk about it. Go through a placard system. You get a lot of people not, they're still not working yet. Yeah, bring them on, have them go inspect businesses that can open up. Okay, if it can be done safely, open them up. But when you don't have, you know, when you're trying to shoot for a target date because you want to go to a next tier, to me, you're defeating the purpose. It's almost like a challenge, right?
Yeah,
Because it doesn't matter if you go to the next tier. It doesn't matter one bit whether you open up today or you open them up next week. It does matter. The longer you wait, the more businesses you hurt. Because I still want to arrive to some kind of information that can say, number one, Charlie's Sporting Goods. I went to go look at your business. You know what? It's kind of dangerous. You don't have enough protective equipment for people when they come in. You know, there's no spacing. There's not enough spacing that's going to take place if you got people shopping in there. Because then, I would look at the data and says, well, when we were open, I can see we had no one that contributed to the virus. You got to put all that data together, but it just seems to me that the state just doesn't like to use data. They only use data when it appeases them. Other than that, they don't like use them.
yeah. Well, today it was very clear that Mayor Caldwell's primary goal is to get to tier 3 before Thanksgiving. He missed the mark because right now their average is 90 cases a day, and they need to be below 50. So he's basically pleading with the public today. He spent most of the time pleading with the public not to allow the numbers to rise. That we know about the masks, and And then he was basically saying, if we go back to tier one, you know what that's going to mean? You know, the threats came out. That means you cannot congregate with more than five people in your house. You cannot go to the gym's going close. And he basically all the punishments of going back to tier one, but not once did he mention the trans-Pacific travel and the impacts that the travelers are having on our numbers. Not once. Everything was basically for the people to shape up. Now, while I agree that some of the spread is community spread, and that we know clusters are occurring at gatherings, and we know that Thanksgiving numbers, these numbers that we're seeing right now, I was watching Ed Case and Kai Kahele. They were doing a Facebook Live today. They were doing a Zoom thing, and they had it live on Facebook. And Kai mentioned that the numbers we're seeing today, and I love Kai, don't get me wrong, but he said the numbers the spikes we're seeing today is from Halloween and from the election. It's not. It's too soon, guys. What is it gonna take to get our leaders to understand that the travelers are creating the spikes? Why is that so hard to understand? Listen, Halloween numbers is not there yet. Election was just not, that's definitely not here yet. Kauai, use Kauai as an example. 11 out of the 12 active cases travel related from travelers coming off the plane. So we're no different than the other islands. Yes, you get one infection and they go into a gathering, it'll spread, you'll get a cluster. But you cannot completely ignore the fact that all of these guys coming in, how many have we had come in on a pretest that said negative that was actually positive? You see, Kauai released their numbers. Kauai released the numbers. Kauai told us here on Kauai, our administration told us every time somebody had a negative pretest and tested positive on a second test, whether they got sick or they voluntarily took a second test, they told us that. See, because they have nothing to hide. But we have not heard and correct me if I'm wrong. Correct me if I'm wrong. You guys that live on the other islands, can you or any of you tell me, based on the reports that you get from your county administrations or from the state for that matter, can you tell me how many of those people that tested negative, got a negative pretest, that ended up testing positive on a second test, if you even have a second test? Please, I'll look the comments now because I want to see it. If I'm wrong, I'm wrong. I'll admit and I'll apologize. But I have yet to hear any other county come out and said, hey, of the X amount of passengers that came in and took a second test that had a negative pretest, this percent was positive. I have not heard any other county do that. And I'm very thankful that Kauai does that because we get an understanding, and it really, really validates. If you really validate, I mean, it really validates the what we've been saying for a long time, that once you open up the tourists, the trans-Pacific travel, that we will see an increase in numbers. So anyway, I'm just reading. I sorry, Charlie. I'm just reading. Cynthia said nope, not on Maui. Yeah, I mean I haven't heard it, and if they did report it, it would have made the news. We would have seen it, like you all have seen Kauai's one. So that's to me negative on Oahu. Yep, yep, just as I suspected. You see, that is vital information. Rather than spew out garbage for 45 minutes at a press conference on a grass right next to a busy highway where all the cars vroom, vroom, vroom. No, why don't you start talking about the truth and the reality that, hey, as long as we have trans-Pacific travel, now we open up Japan. Now we open up Canada. And Canada is locking down their country. And here we over there, come to Hawaii, Canada. I love Canadians, I love Japanese, I love everybody. But right now is the time we got to protect our shores. We got to protect our people. So as we start blaming the local residents for the spread of this virus, and not even mention trans-Pacific travel, I tell you what, we are way behind the eight ball, way behind the eight ball, especially on Oahu, especially on Oahu. Charles.
Hmm?
Oh, okay.
You said it all.
Just had to vent. Just had to vent because I watched that and I was kind of frustrated. And he said, if we work hard, we can still open up by Thanksgiving, so we can be with 10 people in our house instead of five.
Well, why don't we just start with this? Okay, at the news conference, just ask them. Okay, in the last 2 days, what was the number of travelers arriving on Oahu? Out of those travelers, no, let's go back a week. Let's go back a week. A week ago, Monday, right? How many travelers arrived Monday? So if today's the ninth, right? The second, on November the 2nd, how many travelers arrived on the island of Oahu? Trans-Pacific travelers. Out of them, what were the number of those who took a pretest prior to getting onto the flight to come to Oahu? And since it's been 1 week past, how many of them volunteered to take a second test? See, when you start getting information like that, then they can speak with authority, right? You can put you can put everything in its right context. Right now, they don't know. Only Kauai. Kauai will tell you when the person arrived with a pretest negative, and they will tell you when they took the second test and whether or not they got a positive or negative. They'll tell you that. That's what we talk about being transparent. If you have a mayor that cares about your community, he will have everyone in his cabinet singing the same song, telling you the same information, because they want that information to go out to everyone who resides within this county. That's the only way that he can be successful enough that when there are other messages to be made, everybody can buy into it because they know, A, he's being transparent about it. Honolulu, can you say the same for Caldwell? I guess we know all the answer about that. Forget it. Big Island, can you say the same thing about Harry Kim? I'll give him credit. At least he admit, boy, we don't can keep up with the testing, so we got to nix the program, go with 25%. How is that 25% testing, post-testing collected? Okay. Is it computer generated? They pick the name after everybody landed, pick 25% and says, hey, come here, you going to test? Or you're hoping to get 25% of participants taking the test. That part is not clear yet. Why? Because there's no sustainability of the test, I should say availability of the test, and whether it can sustain the program. That's the reason why they went into this before. They was like, hey, I opt out, I test everybody. It's okay to flex, but no flex if you don't have access to the test kits. Look, from October, not even 1 month, flat tire.
Yeah, like
All you get is you do a program and all you hear is, you know, when they let the air out of the tube.
well, I see Honolulu is canceling all Veterans Day ceremonies. They will have a sign waving thing, and that's kind of a shame. I mean, Veterans Day is a big day for me and for many people, and it's just sad. But again, I go back to the the local residents really, really sacrificing to try their best. Uh, you think about it, we cannot do a lot of things now. We really cannot do a lot of things, and while Honolulu is trying to push for tier 3 so they can open everything up again and focusing on average daily cases and positivity rates and stuff like that, that's a good thing. But we talked about the businesses like you just did earlier tonight, that they're going to throw all the business in one batch and everybody going to pay the price if you know we're going back to tier one. I mean, you know we're going back. I mean, Honolulu going back to tier one, and I think Kauai will see us moving to tier two, or tier three. I'm sorry, we go backwards. We start at tier four and we go back to tier one. But it's just a matter of time before we get to that average daily case, and I think this week we'll probably see the numbers rise significantly. This is my own opinion. But the people for so long in this state have been sacrificing so much. I for myself, I'd love to see my kids. I think a lot of us have kids and grandkids that live away, and we cannot see them. We've been really limited to what we can and cannot do as far as activities, and we don't get recognized for that, right? We get scolding because we're not wearing our masks and we're not social distancing, and we all got to do this so we can get to tier two or tier three on Oahu. And yet at the same time, our state is going through a huge marketing campaign to invite tourists from all over the world now to our island that is being sequestered, the local people being sequestered, really. Hey, you guys, try not to congregate. Don't congregate. Don't go here. Don't go there. Stay home if you have to. I mean, stay home if you don't have to go out. As much as possible, just stay home. But we're telling the tourists, come enjoy our state. Come enjoy the safest place right now. I don't know about you, but that to me is so freaking hypocritical. So how can you stand up there and look at the people, smile to the people, and say, "Hey, bend over, Rover, bend over, because the steamroller is coming,"
You know
and
what?
then tell the visitors, "Hey, come on, come, we're open. Hawaii is open, except if you want local." You know, I get hard time with that, bro. I get extremely hard time with that.
The only time that I remember we had a cluster is when we talked about it with the gyms. Remember? We talked about it with the gyms. Then we talked about it with the Pacific Islander, right? Clusters, community spread clusters. Now, when they're taking these numbers, and I'm just going to ask everybody out there in TV land, ask yourself, they're using a generic statement that it's a community spread, okay? And what were they in clusters? How do they know that? It's bad enough that they said the last time when the contact tracers was asking questions, they weren't getting cooperation from half the people they were talking to. So where are they getting this information from? I mean,
Good question.
because it's like this. You got 100 guys in a room in one auditorium. You're an all-out brawl, and the guys who fighting stay on the north end while everybody on the south end watching. But the police come in through the door and they arrest most of the people on the south end who wasn't even part of that fight. So nobody's asking that question. Hey, we were just standing here minding our business. The guys on the north end is the one fighting. They're the ones making the trouble. Go after them. We have the same scenario with how this so-called cluster reporting. You're gonna get one cluster in maybe Central Oahu or any island. Let's move to let's move to the big island of Hawaii. You get an outbreak in Hilo, but then you go penalize everybody in Kona. No make sense. No make sense.
Yeah.
And so that's why I've always asked, you say something like that, it's just like when you put out one bolo, with APB, right? Be on the lookout. If you want to pick up Charlie Iona, you don't go and describe Mel Raposo. And that's what they're doing. They're putting out this all-point bulletin. They want to pick me up, but yet they describing me as having white hair, 5 feet 8, 180 pounds. Like what? You coming after Charlie Iona? Okay, go pick up Mel Raposo. That's what you describing. And it just continually happens over and over again. And I think that's why uh, a lot of people are they're getting miffed already. They're getting miffed because that would, to me, I think the story would be that would be the easiest thing to say when we have a breakout. Just say it was community spread was a cluster and stop it at that. Don't say anything else. Try watch. Everybody, do your own study. The next couple outbreaks we get, try see what they're gonna say. See if they'll say, "Oh, yeah, it was community spread. It's a cluster." Some people earlier today disagreed with us when we said about the traveler. All we're saying is this: we have known travelers because Kauai. We have the study to prove it. They came in with a negative testing, and they became positive, and was found to be positive on a second test. So all we're saying is it's very easy for them to come, deposit, and aloha oe, leave back the virus. Aren't we trying to keep the virus out? That means zero virus coming in. How do you do that? You find, you locate, you isolate. That's why you go from quarantine to isolation. Is anybody isolating? I can tell you Kauai is doing it. I'm pretty sure the other islands are trying to do it. I know Lanai is doing it because it's a small community. They're isolating. But you cannot tell me everyone is doing that right now because the word
Yeah,
is we have a community spread and it's a cluster. And that's all you need to know because I ain't telling you nothing else.
I think Lanai going to lift up the, if they haven't already, I think it was today. They're going to lift up the lockdown. Um, but I think as we see numbers rise, I don't know. Like I said, I really wish we would know how many people were being tested. You see, now you understand why the governor did not allow the counties to do a second test, mandate a second test without with the quarantine. Now we understand why, because
The
we'd have a
number,
ton of people in quarantine, man. We'd have a ton of people. It would have blown his safe travel program out of the water.
no, the number he used, that ratio, that entire argument will be blown out of the water.
Yep. Because remember now, Kauai only 2% of the visitors took a second test. You know that. So 98% of the visitors that came to Kauai did not take a second test. Now, one of the gentlemen didn't take the second test, but he got sick and he's in the hospital. So that's how we found that one out. But not many of them, very, very few are volunteering to take the second test. And that is where the governor should have allowed the mayors to do whatever they felt. Now, today it was so funny. Caldwell said they asked, "How come the governor hasn't done a mask mandate?" And he said, "Well, right away he jumped to the president. He said that should come from the president. That should come from the federal government." Like, brother, why you punt to the president? Leave him out. It's not. You don't need the president to do a mandatory mask mandate, right? We need the governor to do it. We need the governor to do it. No, 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 no punt. That's a sorry ass sign of a leader, bro. I'm gonna tell you right now. That Charlie, you and I both know this. You know when you was a cop, you went to your sergeant, lieutenant, you ask him a question, and the jackass say, "Oh no, as somebody, no, it's not nobody else. It's you. You are the leader. And if you cannot handle that, step down. Step down. Don't go blame somebody that you. No, your governor, by the stroke of a pen, can do that. Now Josh Green all of a sudden is saying, I'm encouraging the legislature because the governor no like. I'm going to the legislature now and ask them to pass the law.
You know when you said about punt, the reason I laughing.
About
Remember
what?
when when you said they just punt the ball, right? Then punt. They
Fun,
just yeah.
fun.
The reason I laughing is because I think as a small kid, when you play football on the streets and you get all the big brothers ready for tackle you, and you take the ball, you go, you just kick the ball, and they
Yeah,
fly in the neighbor's yard. You can not get them back because you got a big dog over there eating the ball alive. That's what I was thinking. You just go you just go ruin the game and just get rid of that ball. You hit the nail right on the kidney popo, brother.
just
Right.
come on, guys. Grow a pair, grow a pair, and get it done. I mean, I had to go kapat today. I had to go drop off one box at the post office, and I look on the road, man. All these tourists. You see, they I was at the red light by Safeway or Foodland. Get the crosswalk. No, Safeway. Get the crosswalk. Go right
But
across to that Waipole
yeah,
beautiful hotel, whatever that condos or what.
yeah.
And I see two couples, two different couples with their groceries. They know where they're going. They definitely don't live here. No more mask. No more mask. Just screw you guys. We don't have to. And you know what, you can say, well, they know it's hurting nobody. No, listen, you see, it's about respect. It's about the respect for Hawaii. And if you know more that kind, and if you don't like wear one mask, stay home. You know,
Well, I tell
it's
you
just
what.
frustrating. It's just and listening to Caldwell talk about, just answer the question: why is the governor uh, holding off on doing a mask mandate? Because he no more balls. Why don't you just say that? Because he no more the balls. Just Caldwell, just call it like it is, man. He no more the balls. So to protect him, I'm gonna punt to the president. Oh, sorry, sorry, sorry. No, it's bottom line. Do the mask mandate, get it over with, because you see what's gonna happen, Charlie. And this, I was thinking about this today as I was watching the numbers in the other states. As I was watching the numbers just get bro, people, they're putting patients on the floors of some hospitals because no more bed space, so they get them temporarily on the floor. I'm thinking, why are we going to wait to get to that point? When, because it's like like when you push one you push your bike up the hill, and then when you get to the top of the hill, and then you can stop them. See, why are we going to wait for that? Why are we not preparing? Why are we not trying to stop the spread of this virus before we got to do the reactive measures? Why are we not locking down? Why are we not locking down the visitors? Why are we not making sure that they're safe before they come here? Why are we not doing those things now? Why are we waiting for the numbers to get to a point where we cannot handle? When the hospitals get full, we trust me, Kauai, we get three already in the hospital. Three COVID patients. That's not counting the regular patients that's got to stay in the hospital.
Well,
Why are we waiting till we get to that point of no return, to the point where the growth of this virus or the spread is exponential? Why are we waiting? That's what I don't understand.
let's remember one thing. If we've seen all that repeated um, cameo, I shouldn't say cameo, but repeated shots from a distance within an ICU unit, they've got an average of 4 to 5 people per patient. Okay, if you've got 11, if you've got 11 beds in the ICU, five per bed, that means that's 55 staff per shift. Now, if you run a 12-hour shift, that means that you go to 110 staff per day. Now you see why they get burnt out, and they have to. rotate as many times as possible. But I wanted to talk about something I think it's important. I deal with individuals coming into the island of Kauai. Kauai is a little different. It's a little different. Now, for those of you who are coming back and who are requiring to apply for that critical infrastructure, um, what is that, waiver when you come in, okay? That approval is given by I guess, by the mayor's office. Once you apply for it in the apps itself. But everybody out there, you just got to remember now, what it does, it modifies your quarantine. It gives you the right to work. Gives you the right to work. But when you're done working, you have to go back to your place of lodging. And if you're taking that critical infrastructure waiver, you have to, and you're from off island coming to Kauai to work, you have to be lodging at a hotel. You cannot be lodging at a friend's place or any other place. It's not going to work. It's not going to work because you didn't take a test, right? Now this applies for those who are going to come here for a couple of days to work and not going to take not going to take a test, and you qualify under that critical infrastructure, and then you apply to it. Just know that number one, you have to be housed at a hotel. You can't be any other place. It's not going to work. Okay. You will get the clearance. Once you get that clearance will allow you to go get a rent a car. Without it, you get nothing because you can be like anybody else. 14-day quarantine. You can't even go work. Just go to your lodge. And if it's not a hotel, and if it's like a resident, you're staying with family, I can guarantee you're gonna be checked on. You're gonna be checked on. So please, if you're coming from the Big Island of Hawaii, or if you're going to the Big Island of Hawaii, or if you're coming from Maui, make sure you look at the trusted partners for the testing. Do not go and get tested from someplace that's not on the list. It's not going to work. Now, I know I just heard today that there's some individuals, or there's some people, I'm sorry, that are coming to Kauai, and they were told by civil defense on the Big Island of Hawaii, on the Kona side, because there is no Walgreens, that they could go to SNG Labs. SNG Labs, yes, there is. There, who's that? Last name is Puana. They own that labs. They were involved in a lot of the mass testing on the Kona coast, Kohala coast side, where most of the hotels are located. Okay. Individuals went to their lab to get tested. They got negative results. But guess what? Those tests are not accepted because they're not part of the trusted partners. You cannot use those tests. Okay, so please know before you do any traveling to any of the islands, please know what you got to get. And the thing is, some people are taking the test last minute and they're landing without test results in hand, and more problems occurring now. So if you go take advantage of the 72-hour test, do it at the 72nd hour and let it count down, and hoping that you get the test in hand before you leave your home island to your destination island. You get the results in your hand. Okay, try to do that because you're gonna have to upload everything onto your smartphone anyway. Okay, so if you can do that, you know, and yes, Kiki Akane, yes, so civil defense on a big island is giving out the wrong information. Is giving out the wrong information. So we did some checking today, and I think they're gonna correct that. They don't have Walgreens on that side of I don't know if they have a CVS on that side. So they may have to travel all the way to Hilo to get tested. But I guess a lot of them are being told go to S&G Labs. And it doesn't even make sense too, Mel. Most of the labs in the state of Hawaii are CLIA certified, CLIA, right? But there's different categories within that certification. I don't know. I don't know why they just don't accept them from, if a person goes to a lab, because a good friend, Nani, she broke it down for us, how you can find out, because you can go online and look for a certification on different doctors who have labs in their practices, and it says what kind of certificate they have, whether it's just a certification, accreditation, if they can only do like drug testing. They can't handle blood or anything like that. They have it they have it all down there. And I don't know why, for the life of me, why they don't allow that so people can get tested. They're gonna pay that kind of money. It's not like they're committing fraud. Who will pay 200
Yeah,
bucks to go test?
I don't know why.
It's crazy.
Hang on, no. Oh, it's like make sure my. Can you hear me, Charlie?
Yes, I can.
Oh, okay. I just had accidentally hit the. Yeah, I wanted to. What Charlie said about that modified exemption, I think is critical,
Yep.
and it's different from how it used to be. Back when we had that first modified exemption, where you had the work exemption that the counties was granting, you could actually go stop at the store or a restaurant, pick up food. Cannot do that anymore. If you're on a modified quarantine exemption from the mayor, and that is granted by the mayor, he has a team of people that go over your request. You go straight home. You go straight to your hotel. You gotta make sure food, your supplies is brought in. So it's not that simple. It's not that simple. So
Mhm.
make sure you guys know what you're doing, and understand what you got to deal with. Because if you get caught, I can tell you, Kauai, they do check. They definitely check.
And there's on the application, it also states if you're going to work, it's going to ask you for the address of the work as well as your lodging. They're going to ask you the hours of work. So if you tell them that you can work from 7 to 3, they're going to give you time because they know where your workplace address, your lodging address, they're going to count for your time to get home. And so once that clock strikes the witching hour when you're supposed to be indoors, you stay indoors until the next morning when you got to leave to go to work. So if you put down that you're working from 7 to 3, okay, anything outside of the 7 to 3 window, that's fair game to get picked up if you're not careful. Okay. So just giving you folks a heads up on it. Just giving you folks a heads up on it. Okay.
Question: what are the restrictions for a UH student originally from California going to Kauai to spend Thanksgiving with Grandpa Ran? I'm not sure what that. Anyone coming here, if it's to Kauai, yeah, coming to Kauai, they got to get a pre-test 72 hours before departure. It has to be negative, otherwise they will quarantine. 14-day quarantine here on Kauai. And
They
if
gotta
they're
fill
here
out
only for
the
the
travel app.
Thanksgiving weekend, they're going to be stuck in the house. And that, that quarantine ad, you can only have one. So if you know someone that's coming to visit family, then they got to quarantine in one address. You cannot say, I'm going to be quarantining in on this address for the first 5 days and in this address for the second 5 days. No, no, no. You get one address. You got to stay there for 14 days.
Hmm.
So make sure you understand. Even if they're in Oahu, it doesn't matter where they're from, where they're coming from. If they come to Kauai, they have to get that test 72 hours before departure, and then they will quarantine. If they don't have the results, by the time they get here, they will quarantine until the results come in. And then we encourage them to get a second test that is provided by the county. There is a fee
Free.
if you're not a resident, but we encourage that. I'm looking at
Dad,
some of these
on
comments. They
your
said
dad.
downtown Longs in Hilo had a sign today that they're not doing COVID testing. Walgreen at Market City in Kapahulu closing down this Thursday. Wow,
Yeah,
it's
a
gonna
lot
get
of
tougher and tougher, man.
yeah.
Wow.
So there's a lot of things. Just keep yourself updated. We try to bring you the information. If we find out why these areas, we've been hearing, Mel and I have been hearing things like uh the only test that's accepted is the polymerase, uh or the PCR, I should say. Okay, a chain reaction test. That's the one they stick the nasopharyngeal, stick it up your nose. That's the only one they're accepting. So if they have one that's going to be used and they tell you, oh, it's a rapid test, a rapid antigen test, I did not see rapid antigen on that list. It has to be a PCR um, test. So just make sure if you have any questions, you can call wherever island you're on, call your emergency management and they can or go online to that island's website and they give you they have all the information what you need to know. I'm pleading with all of you. The reason why I just don't want any one of you going to an island and getting the kicking the okole because got all these rules that you didn't know about. You cannot claim ignorance. Please don't do that. I'm telling you now. If you're going next week, start researching now. Okay, our good friend Sean Pimentel, he did it in California. He researched until he had no more to research. That's what led him to almost 150 miles away to get on test because he saw what he needed just to get back home and to avoid quarantine. Okay, because as a musician, as a professional, he had other gigs waiting. He couldn't be tied down. So what he did, he found all the information. So that's why I'm saying to all of you out there, please do your homework. I'm going to be very honest and I'm going to sound very, very mean. The travelers are going to come here whether they want to come or not. Okay. I'm worrying about our Ohana, our community. It seems like there's a lot of information for the traveler. Okay. That's not from Hawaii. There's very little information for our community Ohana to travel between islands. I want to make it a point that we get that information for you because nobody should be left in the dark. Because if you're giving the red carpet treatment, just because, hey, I tell you what, when my wife and I used to travel, I can tell you right now, we spend way more money than the average tourist coming to the islands when we go Big Island, when we go Maui. Because why? We support local business. Where you gonna find one dining out, $80 tab, and my wife and I leaving $40, $50 tip on $80 tab. Why? Because we appreciate local labor. We're gonna take care of the locals. That's the right thing to do. Okay? Because we hear too many times, oh uncle, they only leave us a couple of dollars. Hey, they get families to feed too. They gotta pay taxes too. Why not give them extra money? But in order to even to get to that point, what I'm saying now with COVID, we all gotta do our homework and we all gotta be akamai. And if you cannot find the information, private message me or Uncle Mel. We're gonna get the information for you. Because we don't like you go someplace and get left in the dark. It's almost as if you're gonna travel to parts unknown and nobody gonna help you. I'm not gonna let that happen to you. Okay? So we like everybody be on board with this.
I can tell you, if you come to Kauai and you don't have, especially if you're on that modified exemption and you don't have a hotel, you're not going to leave the airport. I can tell you right now, you are not going to leave the airport. They will keep you at that airport until you book a room, a real room, and you book for, I believe you got to book for the length of the quarantine
Hmm.
or the length of your stay, or whatever is shorter,
Yep.
before you leave. So, Charlie, you hit it right on the head, man. You gotta research. You gotta make sure you understand what the rules are where you're heading, whether it's here or if you went to the mainland. I still honestly do not see why anyone would want to travel for a vacation right now during a pandemic. Understand that some people gotta travel for work or for family matters. Obviously, that's understood, but for the most part, why would you want to travel? My mother-in-law, poor thing, she's 80 plus years old. She wants to go to Vegas. She wants to go to Oregon to see her grandkids. And she came over today and she was asking me, how long more we got to wait? It breaks my heart, because I don't know. And that's what I told her. I said, I don't know how long it's going to take. We don't know. And right now on the mainland is blowing up again. So now is not definitely not the time. And those are the ones, like you said, Charlie, those are the ones I worry about, like my mother-in-law or us. We up there already in age, but more so for her. uh, innocently can the virus could pass to her if I decided to go to the mainland because I needed to go see my kids or whatever, and just that damn COVID exposure that I had no idea, and I come home and I take the test and I get the 3-day test and it's negative, but the virus is brewing in my body yet, and I come home and I get the false sense of security because my test was negative. I come here and I get back home on day 4, day 5, the virus is brewing. I know I can go take the test, the free county test on my third day, which would be day 6. But in the meantime, I happen to pass by my mother-in-law and I pass her the virus. And my
Mm.
mother-in-law gets sick. She gets alone in a hospital room, ICU, and she dies. Yeah, because I couldn't wait to go on my vacation. That's
Yep.
how I think about it. See, that's the kind of stuff that happens. You know, you watch the football game the other day, Clemson versus was that no I forget was it Notre Dame? I can't remember who, but Clemson got upset majorly, right? Number one ranked team. The entire stands went on the field. All those college kids was just thousands and thousands and thousands because they were so happy. Now, you think they wanted to go spread virus? Of course not. Yeah, but the emotions got so overwhelming that they were so excited they beat the number one team. Same thing happens. We were talking about this today, Charlie. Same thing happens in a bar or at a funeral when you come
Yep.
across people that you haven't seen for a long time, somebody grieving over the loss of a family member. How the hell are you going over there and not go hug that person?
Remember what I told you today about the bar?
Yeah.
The biggest problem with bars is inhibition, because there you have a bartender that's supposed to keep an eye on you when he's serving you, right?
Mm-hmm.
So most people go in sober, they see one beautiful wahine. Most guys, guys with all pimples on their face, real ugly, and they like to pick up a nice girl. They figure my only chance is build up courage. I go ask her out, but he too scared. After a few drinks, I come like Superman. He go, yeah, I'm Johnny GQ now. Even though he get blackheads all over the place, he don't care. He going after her. That's the problem. Is when they have a little bit too much drinks under their belt. They went into the bar knowing that there's a possibility you can catch COVID or transmit COVID. So you be as safe as possible, right? Wear a mask, do everything. After a few drinks under your breath, what happened? The mask come off because you forget, right? Now, if you get that much pimples on your face, leave the damn mask on. Okay? Let Auntie find out after when she turn on the light at home, when she see your map, see all your pimples. But that's what happens. And that's the reason why, like Mel said, if you're going into a bar, those kind of situation is bad. And I think nobody went on that field to go and congratulate wanting to catch the virus. But when you're so happy, all those alarms that doesn't go off. You forget everything that you were taught, everything that Mel and Charlie talked about for the last 8 months. Poof, out the window.
Yep.
Yep.
That's kind of how it works, man. And
Yep.
that is why that's and people think that we're unfair to bars, but think about it. We thought I made a post today. Charlie been saying this for a long time that when you evaluate businesses, who gonna open, who gonna close. I know Tommy Silva's on tonight from TNT Tinting. The guy went through great expense to make his operation safe,
Hmm.
huge expense, and many others did the same thing. Many others redid their operations not just to keep their customers safe, but to keep their employees safe and keep their families safe. For the same reasons I talked about going on a trip to the mainland, coming back, passing on that to my mother-in-law, no difference than me going to work or going anywhere else that this virus might be, right? So we gotta be safe. But you take a look at the individual business. If that business is not uh, creating an environment that is conducive to spreading this virus, then why would you shut them down just because? Because we're changing the tiers. Now, likewise, if you have if you have a business like a bar where people going to forget, come on, we know what happens in those places. Now I know all the bar owners going to hate me for this. All the people that like suck them up going to hate me for this. But listen, this is honest. I was thinking about this today, Charlie. I seriously, I was thinking about this today. After we spoke on the phone, I was thinking, you know what would be you know what? Let's say I was the governor or the mayor of Honolulu. Kawhi, we no more tiers for businesses. Honolulu does. I would say, listen, hey, bars, if you like open and you convince us that you get one safe operation, see, because we're going to check your operation during the day when no more drunk and alcoholics running around your bar. But you are mandated to hire two off-duty police officers to enforce the safety code. And the reason you need two is because you need two for witness, because stupid things happen in bars. Now they're gonna say, "Wow, that's but extra cost." Well, you know what? Charge your patrons a COVID fee. Say, you know, we gotta hire cops. So when the cop sees the idiot running around, coughing, spitting, yelling, laughing, joking, whatever, the cop can go up there with his PP and take him out or arrest him or whatever. But if you gotta, how do you convince the public that you have a safe operation, right? How do you do that? I was just thinking that'd be the way to do it.
This is what I posted today. And any of you out there that agrees with me, let me know. If you disagree with me, no, let me know. But when you make your operation safe, okay, and you're spending all this money investing in plastics, right? It's funny. We banning plastic bags, we banning plastic containers, but yet everybody like buy plastics. They like plastic masks. So when it's all said and done, you gotta throw them away. But oh, right now it's banned. Okay. What we gotta find out, and we have to do this, is that is there anyone going around and say, for instance, you spend $30,000 to retrofit your business the best way possible. But did you do it in the right way? Did you have a plan that says, okay, for a business that's enclosed, that has only one way in, one way out, with no ventilation, that has centralized air, that has a 10-foot ceiling, and the dimensions is 10 by 20? Does anybody with a level of expertise that can come in and tell you that, hey, brother, hey, sister, you wouldn't spend too much money. You never have to spend 30 grand for it's like fireproof your location. You never have to spend that money. All you have to do is know where to put up the protective barriers in the right place. But it's apparent nobody would tell you, so you just went go for the gusto. And that's what I feel bad about. I think some people are just paying too much money to put all these safety barriers up, and some of them gonna be useless. The state should come up with something, just like an inspecting program. They can go and just tell you, you need to put it here, and this is the reason why you got to take it away from here. Because yeah, if you put barriers in each place, but sometimes when you're looking at airflow, you think you're doing something safe, but if you put on barrier here, it might funnel the wind or whatever, the droplets, towards the person sitting right next to them. You know what I mean? So they're gonna tell you, take them away. So it's those kind of things. Somebody have to go out and inspect everybody and tell them exactly what to do. But you see, when you're young governor leading the way it is, it's just like you're on your own. So everybody getting shell shocked, right? Because who gets the knee jerk reaction? All the guys who shut down business. Who else get knee jerk reactions? Businesses, because why? Like shutdowns, they're gonna do everything possible for stay safe. How do you know how safe you are? I don't know, but I just gonna do whatever I can for stay safe. Bro, maybe you're spending too much money. I don't know, because nobody telling me if I doing them right or wrong. It's just like building one plane, right? The only way you know you built one plane wrong is if nobody gonna like fly with you. That's how you know the plane is built wrong. But until that point, you can spend all the money in the world and try to build a plane.
The problem is that they put every business of every, yeah, every individual business of a category in the same bucket. And so you can have that's what I could never understand is you're gonna go and uh the different risk levels, and I mentioned this months ago.
Hmm.
Different risk levels, yeah, you get high risk, medium risk, low risk, or A, B, C, or whatever. So you could have a low risk business that is has no safety precautions because they're a low risk business. And then you could have a medium risk business, but then they have all the precautions in place, so it becomes much safer
Hmm.
than the low risk. But it doesn't matter with the tier system because they go by category, they go by business type, and not by the individual businesses that may have taken the precautions necessary. And I use TNT tinting because you cannot even come in contact with a human as a customer over there.
Hmm.
Everything is contactless. Everything is contactless. So how in the hell are you going to spread the virus? That's my whole point is when you go into a tier and you go say, okay, all of you non-essential, non-essential, you shut down. But so you'll have essential businesses that are high risk. You'll have non-essential businesses that are low risk, but the low risk will not be able to open, but the high risk can. That defeats the purpose. I guess that's what I'm trying to say. But anyway,
Just imagine, brother. Just imagine. The biggest industry now is weddings. Is weddings. And now all weddings performed on the beaches have to be contactless. And they leave out, you know that you now kiss the bride. Cannot anymore. You guys just look into each other's eyes.
knuckles, 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 knuckle, bang.
Yeah, knuckles. Right
Hey,
after that, you can divorce.
as I was scrolling through these comments relatively quickly, I see at least a couple of you and maybe more have lost loved ones, and you folks
Yes, so
are
sad.
sharing that. Uh, I know I saw Patty, and I saw one more. I think it was Jackie,
Mm-hmm.
Jacqueline, and there may be more. I apologize if I missed you, but
Ribbit.
please accept our condolences. That's the part that is really really hard because last year, a year ago, it's just a no-brainer, right? It's just a no-brainer. You're gonna make your reservations, you're gonna get on a plane, and you're gonna leave. And right now, all of these things. So, our condolences and prayers go out to all of you that have lost loved ones. It's not right. It's not fair. But I after listening to the medical experts today, I actually feel what's going on, Charlie?
Because you told about the knuckle.
Oh,
And
you mean
G said,
knuckle?
you may now knuckle the bride.
Every time you start laughing, I don't know if you're laughing at me like I got a booger hanging or. But after listening to those doctors today and the scientists from different universities, non-political people, non-politicians, I actually am, for the first time in a long time, am feeling some sense that we're seeing the light at the end of the tunnel. And while it may be another year, while it may be another 8 months or a year, uh, there's some hope and promise that this will pass. This will pass. So we've been doing it this far. Yeah, we've come this far. Let's just hang on and see this thing through and do the best we can with what we got. And again, we're going to talk about the the masks and the social distancing and the washing your hands, and please stay away from those congregations. Listen, I mean gatherings. I see so many pictures on Facebook from friends, very close friends, that are out and about in bars, at the beach in the pavilions. And listen, I understand that that's our culture. That's what we do. But do me a favor, and this is just a personal favor I ask. If you can do that, don't post them on Facebook because it irritates a lot of people. Again, we try to minimize the tension that this thing is causing. When pictures like that show up on Facebook, it gets people angry. Yeah, because it's like we are here trying to ask everybody to do their part. And members of your household, that's a different story. That's fine. But when you get, and I know some of you guys already know who I'm talking about, right? It might be you, and I apologize. You can unfriend me. I feel it's that important though that I need to bring it up. Just don't do that. Don't put the pictures up on Facebook. Share them amongst each other, yourselves. Go, hey, check it out, guys. We never had masks. Yeah. Look at that, man. We know what 6 feet. Yeah. COVID is not real. Yeah, whatever. Do that privately. Don't put them on Facebook. Please. It just raises the tension for people unnecessarily. All right, Charles. Damn, man. It's 8:07 already. That went
Yeah.
by.
I just wanted to come on tonight with or without a guest. Just talk to all of our viewers because we pretty soon we are definitely going into uncharted waters. We have possibly a new president, possibly a new direction. We don't know. Whatever, you know, if it gets to the point we're doing everything possible, and then we got to try a new direction on how we fight this thing. Let's come up with our minds open, with our ears open, listen. What was really important for me was to get the message out. I worry about our community. You want to travel into Ireland, you can do it safely, but make sure you do your homework. Every island is different. Look at what the requirements are to get on that island. Okay, because once you already arrive, there's really nothing much we can do. You got to try to do everything before you get to that island, and make sure it's sound. You follow the rules, and then you're gonna be okay. Nobody gonna really kill you. Okay. Um, I do want to say in closing, thank you again for all of you. Uh, some of you are very happy. Uncle Charlie is back. I posted on my jokes again. I say my joking mood because I know right now we gotta lighten up a little. So every day I'm gonna put about I was gonna put about maybe 12 jokes a day, but today I got mean kind scolding from Mrs. Iona. So I'm gonna put up maybe just one or two a day. Then when she goes sleep, I'm gonna put some more on so you guys can laugh in the middle of the night. But definitely I'm gonna put on more jokes. Okay? You guys take care now. Back to
Right
you,
on.
Uncle Mel.
Right on, Charlie. Thank you very much. Hey, Roxanne, whoever told you that COVID is not real, uh, please message them tonight, right out, or do them right now, and say they have an open invitation to come on our show. You know what? Tomorrow night. Tell them come on tomorrow night, and they can have 1 hour. And I mean this, Roxanne. I mean this with all my heart. They will have 1 hour. I'll mute myself, and they can explain. They'll have 1 hour to explain to the world why they believe COVID is not real. So Roxanne, do that for me, please. Um,
And not
seriously.
not the guy come on and go, I'll go tell you why it's unreal. I go, oh boy.
No, I mean it. I mean it. We'll give him the 1 hour, and he can try convince us that COVID is not real. And if he doesn't want to do that, or she doesn't want to do that, tell him to zip it. Yeah, because easy for talk keyboard style. But come here, so the face come on the screen, and seriously, bring the data, bring the research. Don't just bring lip, bring the data, and then we'll have the debate. We will have the debate. And if he like 1 hour all by himself or herself, we'll give him that. I'll turn off my screen and I'll just sit back and listen. I'll grab some popcorn. Because, that to me is an insult to anybody's intelligence. When anybody can come up here in today's day and age, after all of what we know now about this virus, anybody that can come up and say it's fake, then they need help. They need help. They need God. They need help. So please, Roxanne, if you can do that for me, I appreciate it. She may not have a job, so she will have time. Perfect. Bring it. If it's a she, bring it. But not just come with lips. I like some data. But either way, I'm blocking tomorrow night off for Roxanne's friend. Let me know ASAP. I'll send her the link and we'll have the debate tomorrow night. I'm excited now. Gosh, I don't can sleep tonight. We're probably gonna have to give Charlie one pass because otherwise you're gonna punch right through the screen.
No, no, I'm just gonna be the mellow, mild mannered Clark Kent.
Yeah, that really bothers me. When people,
Putting Mel, I'm the calm one between the two. When I say I calm, and I watching him, I'm going, okay, we're gonna have a debate tomorrow. The last time I was in a debate competition was I think was in the third grade. We debated about Einstein and physics when I was in the third grade.
you know, sometimes Charlie, and don't take this in a wrong way, but sometimes I wish we never got involved with this.
Yeah.
Sometimes I wish we just never get involved, and we wouldn't have spoken to all the people that we have. We wouldn't
Uh-huh.
have learned as much as we've had. We wouldn't have had uh, George and Sarah and Lana and Russell. We wouldn't have met those people. We
Yeah.
wouldn't have heard from all the doctors from around the world, really. We wouldn't have had all of that. We could have just been pissed off with the fact that the numbers no match. But certain things
You,
push my
you know what it
button.
is?
And one of them is people that say this is not real. That
Let,
one to me, that
let, me-
bugger is rough.
let me tell you why. And this is just my 2 cents. But because I have pake, I should say 1/4 pake, I'm gonna keep 1 cent so I can at least buy something. I'll give you 1 cent if I'm wrong. The reason why some people are like that now is for the following reasons. It's very easy to be negative because to be positive, you really got to use a lot of brain power. Because everything we explain, we had to make sure that we explain it in such a way, even though it's simple, but we had to make sure that it came out of our mouths as correct as possible. So those on the other end who were receiving that information understood it well. Because if I was to explain anything tonight and nobody got the gist of what I said, that I failed at communicating my message. And that's the same damn thing that happened with the governor and the administration. They failed to give the message so everybody can understand what the hell is going on. I'm not gonna get mad. I'm not gonna get mad.
Charles,
No, I know.
Charles, what the hell was that?
Was my way of
Charles.
saying yes. You know, see, you do this. Mm. I got my incense going. I got my incense burning. Yeah, right now it's burning. But what you have to make sure is that you use that brain power for all the right reasons so we can communicate the message effectively. So it's very easy for the naysayers because when they debate, they don't know what debate is. So all they're going to say is one thing: fake, flu. You notice they all talk the same lingo. It's fake, the flu. Yet us who understand this, with all the experts that come on, I can tell you, everyone that has followed us for the last 8 months, they just as Akamai experts as those experts themselves because they rode this roller coaster ride with us and they know everything that happened. And they have every right to talk to people and let them know what they know. Nobody should back down. You let them know because you got it firsthand.
You feel better now?
Well, I'm always feeling good.
I always enjoy a good debate. But it's certain things really really set me off, and it's the one about this being fake. Yeah, in the beginning, I tell you, Charlie, you know this. I when this thing first broke, I was like, Jesus Christ, everybody getting crazy for one flu. You know, I really did, and but it didn't take long to
Yep,
understand and realize, and a lot of it had to do with your brother,
yep.
that this wasn't just a damn flu. And since then, my position on this has just solidified that this is definitely not the flu. And
Let me tell you, brother.
I feel for the people. I really feel for the people that are still struggling. Obviously, the people that never survived it, their families. I feel for them, like you, Charlie. But all of those that are out there that will never be the same again, will never breathe the same, will never be able, their legs no work the same, their memory, their fog, their, how dare you insulting jackasses try to convince anyone that this is just the flu? Come on, man.
I will
Anyway, we
I
better
will
stop
share
for
with
a second,
you.
man.
Um, next week, next week will be 1 year. Will be one, well, no, no, no. The week after, the week of the 23rd. Okay, not next week. The week after will be 1 year where my brother, who passed away from COVID, he had found me and my second oldest brother, but he had never met our oldest brother who lives in San Diego. And that's the picture I post all the time when there's four of us standing. That's at the South Point Casino when all the brothers got together. So this month is special for me because it represents 1 year the brothers, the Iona brothers, could all be together. So, whew,
Yep, yep.
yeah.
I remember that trip, Charlie. I mean, I wasn't there, but I remember you and Stephanie and how happy. But anyway,
Hmm.
follow your negative people. I learned this long time ago. If you're struggling to get positive, you're struggling, you're fighting yourself to get positive, just go outside to your car, open up the hood, find the battery, and bite the positive battery terminal. Let's get positive, everybody. Let's get positive. My good friend Dave Savula taught me that. Just go out there and bite the positive side. Hang on to the negative and bite the positive side. Get positive. That's how you do
But you gotta wear band-aid on the left ear now when you do that.
them.
Because the fan will definitely slap you a couple times with a thing trying to kick over.
Well, I cannot wait till this passes. I'm thinking sometime in late 2021 or maybe early 20, maybe New Year's, Charlie. Let's shoot for New Year's of 2022. We'll do a hell of a New Year's party, man.
Oh yeah, yeah.
We'll do a hell of a New Year's party for all our newfound friends and a lot of you guys, man. We love you guys so much. You guys are here every night. Appreciate you guys.
And I will go back playing music for all of you.
And I'm gonna join you.
I'm gonna have my group. We're gonna get together for that one good party where we can all get together, Kani Kapila, and play nice nahi nahi music for all of you, or Hawaiian music. Whew.
And I'll be right there, bro. Everybody, you guys take care. God bless. We'll see you guys tomorrow night, 7 o'clock. We love you guys, man. Stay safe. God bless. Aloha.